Trachoma. Introduction. Trachoma is a chronic infectious eye disease caused by Chlamydia trachomatis. It is the leading infectious cause of blindness worldwide, primarily affecting populations in poor, rural areas with inadequate hygiene and limited access to health care. The disease is characterized by repeated episodes of conjunctival inflammation, leading to scarring, eyelid deformities, and corneal damage, which may result in vision loss if left untreated. Definitions. According to the World Health Organization, trachoma is a neglected tropical disease caused by infection with Chlamydia trachomatis, leading to chronic conjunctivitis, progressive scarring, and blindness. According to the Centers for Disease Control and Prevention, CDC, a bacterial eye infection that, if repeated over time, causes scarring of the inner eyelid, turning the eyelashes inward, which can damage the cornea and lead to blindness. Etiology. Trachoma is caused by repeated infections with Chlamydia trachomatis, a gram-negative, obligate intracellular bacterium that affects the conjunctiva. The infection triggers a chronic inflammatory response, leading to progressive scarring and deformity of the eyelids. This process damages the cornea, ultimately causing vision loss. Classification of trachoma. 1. Based on disease progression. Classification. TF. Trachoma. 2. Inflammation, follicular presence of 5 or more follicles in the upper tarsal conjunctiva. TI. Trachoma. 2. Inflammation, intense severe conjunctival thickening and inflammation. TS. Trachoma. 2. Scarring, visible scarring of the conjunctiva. TT. Trachoma. 2. Trichiasis, inward turning of eyelashes, entropion, leading to corneal damage. CO. Corneal opacity, vision impairment due to corneal scarring. 2. Based on severity. Mild trachoma, early stage with mild follicular inflammation. Moderate trachoma, increased inflammation with conjunctival thickening. Severe trachoma, scarring, eyelid deformities, and high risk of blindness. Pathophysiology. Initial Chlamydia trachomatis infection, contaminated hands, objects, or flies. Down arrow. Conjunctival inflammation, follicular reaction with immune cell infiltration. Down arrow. Recurrent infections leading to fibrosis, chronic inflammation causing scarring of conjunctival tissue. Down arrow. Eyelid deformity and trichiasis, scarring pulls eyelid inward, causing eyelashes to scratch the cornea. Down arrow. Corneal ulceration and opacity, repeated trauma results in corneal damage and vision impairment. Down arrow. Blindness, permanent vision loss due to scarring and corneal damage. Clinical manifestations. Early symptoms. Red, irritated eyes. Mucopurulent discharge. Swollen eyelids. Itching and discomfort. Advanced symptoms. Eye pain and sensitivity to light, photophobia. Eyelid deformities, trichiasis, entropion. Corneal clouding and scarring. Progressive vision loss leading to blindness. Diagnostic evaluation. History taking. A thorough history helps in identifying risk factors, symptoms, and disease progression. Key components include personal history. Age. Children aged 1 to 9 years are most commonly affected. Gender. Women are at higher risk due to child care responsibilities. Occupation. Living and working conditions affecting hygiene and exposure. Chief complaints. Eye redness and irritation. Mucopurulent discharge. Foreign body sensation. Blurred vision. History of present illness. Duration and recurrence of symptoms. History of previous eye infections. Progression from mild conjunctivitis to corneal opacity. Any prior treatments, antibiotics, surgery, etc. Past medical and surgical history. History of repeated eye infections. Previous trachoma-related surgeries, example tarsal rotation surgery. Presence of underlying conditions such as malnutrition or immunodeficiency. Family and social history. Close contact with affected individuals. Poor sanitation and hygiene practices. Limited access to clean water and health care. Presence of eye-seeking flies in the community. Environmental history. Living in endemic areas, example Africa, Asia, Middle East. Exposure to crowded conditions. Availability of sanitation facilities and water supply. Physical examination. A comprehensive eye examination is necessary for diagnosing trachoma and assessing disease severity. General inspection. Observe facial hygiene and presence of discharge around the eyes. Assess overall nutritional status and presence of vitamin A deficiency. Eye examination. Eyelid examination. Look for inward turning eyelashes, trichiasis, thickened eyelids, and scarring. Conjunctival assessment. Check for inflammation, follicles, and papillary hypertrophy on the upper tarsal conjunctiva. Corneal examination. Assess for opacity, ulceration, and neovascularization. Lymph node examination. Palpate preauricular lymph nodes for swelling, suggesting an active infection. Trachoma grading system examination. TF. Trachoma 2 follicular presence of 5 or more follicles in the upper conjunctiva. TI. Trachoma 2 inflammation, intense thickening and severe conjunctival inflammation. TS. Trachoma 2 scarring, visible scarring of the conjunctiva. TT. Trachoma 2 trichiasis, inward turning eyelashes damaging the cornea. CO. Corneal opacity, vision impairment due to corneal scarring. Diagnostic tests. Laboratory and imaging tests confirm the presence of Chlamydia trachomatis and evaluate the extent of damage. Laboratory investigations. GIM staining detects Chlamydia trachomatis inclusion bodies in conjunctival scrapings. Polymerase chain reaction, PCR, highly sensitive test to detect bacterial DNA. Enzyme-linked immunosorbent assay, ELISA identifies chlamydial antigens. Ophthalmologic tests. Slit lamp examination, evaluates conjunctival inflammation, corneal opacity, and trichiasis. Visual acuity test, assesses the extent of vision impairment. Fluorescein staining, identifies corneal abrasions or ulcers. Additional tests, if necessary. Culture and sensitivity testing, determines bacterial resistance to antibiotics in recurrent infections. Schirmer's test, assesses tear production if dry eye symptoms are present. Medical management. Antibiotic therapy. Oral azithromycin, single-dose first-line treatment to eliminate infection. Topical tetracycline 1% eye ointment, applied twice daily for 6 weeks. Surgical management. Eyelid surgery, bilateral tarsal rotation surgery, BTRS corrects entropion and trichiasis. Corneal transplantation, for severe corneal scarring and vision restoration. Nursing management. Risk for infection related to bacterial conjunctival inflammation and poor hygiene. Interventions. Educate the patient and caregivers on proper eye hygiene, including frequent hand washing and avoiding eye rubbing. Encourage regular face washing with clean water and soap to reduce bacterial transmission. Administer prescribed antibiotics such as oral azithromycin and topical tetracycline as per the healthcare provider's instructions. Promote community awareness programs on trachoma prevention, including WHO safe strategy, surgery, antibiotics, facial cleanliness, and environmental improvement. Monitor for signs of recurrent infection, such as eye redness, discharge, and irritation. Impaired vision related to corneal scarring and opacity. Interventions. Monitor visual acuity regularly using tools like the Snellen chart. Encourage protective measures such as wearing sunglasses or protective eyewear to prevent further corneal damage. Refer to an ophthalmologist for early intervention, including possible surgical management, eyelid correction or corneal transplantation. Assist the patient with adaptive techniques for daily activities if vision impairment is significant. Provide emotional support and counseling to help the patient cope with potential vision loss. Acute pain and discomfort related to eye irritation and inflammation. Interventions. Administer prescribed antibiotics and anti-inflammatory medications to reduce infection and irritation. Apply cold compresses to soothe eye discomfort and minimize inflammation. Encourage the patient to avoid touching or rubbing the eyes to prevent worsening of symptoms. Educate on the importance of completing the full course of antibiotic treatment to prevent recurrence. Provide a calm and comfortable environment to reduce eye strain and sensitivity to light. Risk for social isolation related to vision impairment and cosmetic concerns. Interventions. Encourage participation in support groups or counseling sessions for individuals with visual impairment. Educate family members on how to support and assist the patient with daily activities. Refer to rehabilitation services or low vision specialists for adaptive training and assistive devices. Encourage social interactions by helping the patient develop coping strategies to manage vision loss and confidence in social settings. Provide reassurance and emotional support to reduce anxiety and depression associated with impaired vision. Deficient knowledge related to lack of awareness about trachoma and its complications. Interventions. Educate the patient and caregivers on the cause, transmission, and prevention of trachoma. Explain the importance of completing antibiotic treatment and attending follow-up appointments. Demonstrate proper face and hand hygiene techniques to prevent reinfection. Provide information about community resources and public health initiatives for trachoma control. Use visual aids and simple language to ensure understanding, especially in low literacy populations. Prevention, safe strategy by who?s surgery, to correct trichiasis and prevent corneal damage. A. Antibiotics, mass drug administration of azithromycin to eliminate Chlamydia trachomatis. F. Facial cleanliness, regular washing of the face to reduce transmission. E. Environmental improvement, access to clean water, proper sanitation, and control of flies. Complications. Corneal ulceration. Permanent blindness. Secondary bacterial infections. Chronic conjunctivitis leading to disability. Conclusion. Trachoma remains a significant public health issue, particularly in underdeveloped regions with poor sanitation and healthcare access. Early detection, timely antibiotic treatment, and preventive strategies such as facial hygiene and environmental improvements are key to controlling and eliminating the disease. Global initiatives like WHO's SAFE strategy continue to play a vital role in reducing the burden of trachoma and preventing blindness.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.